Thank you for having me. It is a pleasure to be here to talk more about the field of dietetics. We dietitians are a small profession, so it is particularly important for us to share our journey to move the profession forward to inspire the next generation of dietitians.
So, as I just mentioned, you currently work as a critical care dietitian. Tell us a bit more about this role and how it shows that the role of dietetics has changed.
Yes, so as a critical care dietitian, I work as part of a care team providing care for critically ill patients. This includes identifying patients at nutritional risk, advising on evidence-based nutritional treatment plans, and making decisions about feeding methods. Nowadays, many dietitians are playing extended roles within clinical practice. Many roles that were traditionally held by nursing or medical professionals are now held by dietitians working beyond their recognised scope of practice.
Interesting. So, what has given rise to this change?
Originally came about as part of an effort to modernise the NHS and to transform healthcare services. This involved extended roles for some allied health professionals such as dietitians. We've seen that it has boosted job satisfaction, improved the dietetic profile, enhanced multidisciplinary team learning, and most of all, it has provided better patient care. It is important to remember that allied health professionals are the third largest workforce within the NHS, so it is important to look for ways to develop more advanced clinical practice posts that take advantage of their expertise and skills.
So, with these extended roles, are dietitians working with more complex cases?
Yes, we are certainly seeing dietitians take on more advanced practice. A couple of months ago, there was a patient at my hospital whose care team included two specialised dietitians, one that worked in the ICU and the other one was a bariatric dietitian. A patient who had had bariatric surgery 8 years ago was in a car accident. The ICU dietitian completed an initial assessment and made decisions about the feeding options, and the bariatric dietitian was called in as an expert on filling and adjusting gastric bands.
That is so interesting. I would never have thought that dietitians would be involved with those aspects of patient care.
About 20 years ago, it wouldn't have been the case. These complex cases and expanded roles of dietitians are part of the reason the British Dietetic Association has taken the important step of putting together 4 pillars of practice that all advanced practitioners must take into account as they develop throughout their career.
It is great to hear there is some framework to guide this transition into advanced practice. Can you tell us a bit more about these pillars?
Of course. So the first pillar is advanced dietetic practice, and it refers to the demonstration of expert knowledge and skills and the management of a complex caseload. The next pillar is related to research and evidence-based practice, and third pillar encompasses leadership and management. As an important part of a multidisciplinary team, it is necessary for dietitians to demonstrate the capacity for shared leadership.
Yes, I would say that is an important competency for all healthcare professionals.
Yes, of course. And the final pillar is related to education and facilitating learning. Dietitians should facilitate the learning of others, actively contribute to specialist groups, and undertake professional development, such as including reflection and feedback in their practice. Of course, the contributions from each pillar will vary depending on the type of job a dietitian holds, such as clinical, research, or work in the private sector.
So, what is next in extending roles for dietitians?
While there has been a change in the way that the NHS thinks of allied health professionals, there is still a lack of funding for dietitians in many areas of clinical practice. Despite evidence of the benefits of having a dietitian as part of the critical care team, no unit in the UK has full-time dietitians. The same is seen in Australia and New Zealand, where only 25% of units have weekly dietetic hours. As you can see, adequate funding is required to ensure consistent and established dietetic input.
I see. As with many other areas of healthcare.